I'm a junior at U of M. I'm from East Grand Rapids, Michigan, and I have two majors, economics and international.
Okay. Um, so I guess jumping right into the COVID diagnosis, when did you start exhibiting symptoms, and when were you diagnosed?
Yeah, so I was studying abroad in Barcelona for the semester, and I started showing symptoms with a fever and a cold-like symptoms, like a cough and a runny nose, on March 8th. So I was still in Spain. I had it that Sunday, the 8th, through like Tuesday or Wednesday that week.
Mhm.
And by the time it was Wednesday, I stopped having the fever and I pretty much only had like a stuffy nose. And then I had to fly home back to the US. And this was before I knew that that sickness that I had was COVID-19.
Mm.
So when I got home, I was like, okay, I should probably get a test because I was in Spain and I was feeling sick that week before. So I got a test on Sunday the 15th and that test came back positive. So I believe that I had it from the 8th through the 11th and I got the positive diagnosis on the 15th.
Okay. How long did it take for you to start kind of, I guess, where was the upswing and the downswing kind of?
Yeah, so that those 3 or 4 days was the worst of it. I had chills, fever, a lot of crud in my throat. I was just generally feeling pretty run down, but honestly, I didn't have any of the shortness of breath or the dry cough that they had been describing at the time. So if in my eyes, I like didn't realize that it was COVID-19 at the time, but it's come to my realization that I was lucky to have symptoms that were mild enough for me to be able to deal with them on my own.
Hmm.
And I was able to get over it while I was there still. And by the time I got back, I was feeling much better. I'm just really grateful that I have an immune system that was able to handle it like that because it is such a scary virus and you never know what your symptoms are going to be if you do have it.
Hmm. And what was your first reaction after hearing the positive diagnosis?
I was a little shocked, honestly, like immediately hearing it. So I got the call right in the morning, right when I woke up, and they were like, "Oh, tested positive," and I was like, "Oh, really? Okay." Um, so I realized that okay, yeah, I did have it. I realized what days that I had it and stuff. It all made sense that
Mhm.
the test was positive, but I was yes shocked, but also I felt super grateful that it wasn't worse than what it was. And I'm also lucky because my whole family were all doing well and I have been in quarantine in my house with them and no one else has shown any symptoms of the virus, luckily.
Mhm.
Um, so I was a little scared at first with the positive test, but I came to terms with it and realized that it's going to be okay. I will get through it and it
Mhm.
would all turn out in the end. And I was luckily able to help some people with my plasma.
Yeah, definitely. What was, I guess, the worst part of the virus? Was it the chills? Was it the fever? What was kind of your experience in that?
Yeah, so I think the worst part of it for me was just feeling really fatigued and having that fever-like feeling. I pretty much stayed in bed for 2 to 3 days when I was feeling the worst of it, and it was just hard for me to not be able to do anything. Like I wasn't going to class, and it turned out to be my last week there in Spain, which is kind of a bummer, but
Hmm.
um, I'm lucky I was able to feel better and get over it.
Hmm. Was being in a foreign country when you had got the diagnosis, did that make it any harder as opposed to being closer to home?
So I didn't get the diagnosis until I got home.
Okay.
So honestly, it didn't really make a difference
Okay.
because I didn't know that I had it when I did have it. So
Hmm.
it was kind of a looking back on it kind of thing for me to reflect upon. And um, it was a little scary to be feeling sick when I knew that COVID-19 was starting to take hold across the world. And in Spain, during that time, the cases were starting to like double overnight. And it was a little scary to think that it could be a reality. And when I did get home and get tested, um, yeah, it was scary, but I am fine with it now. I am okay. So really grateful.
Okay. Um, so were you worried about your family at all coming back with your sickness and then being diagnosed with it?
Yeah. Yeah, so I definitely was worried about my family, and we were very cautious about me once I got home. I didn't leave the house for 14 days and more after that because we did get the diagnosis. We all were required to stay in the house by the health department until the 29th of March.
Hmm.
So that was a little tricky, but we made it through, and I was um super surprised and lucky that none of my family ended up showing symptoms.
Hmm.
But yes, obviously I was worried, and I did feel a little bit guilty for having come home and not knowing that I did have it when I did, and not necessarily knowing what I was doing at the time. But there really was nothing I could do about it. My family was primarily worried about me coming home safely
Hmm.
from my time in Spain, and I'm super happy that I was able to make it back
Hmm.
to
Yeah,
Michigan.
definitely. Um, so can you talk a little bit about plasma donation and how you kind of heard about that and why you wanted to do that?
Yeah, so I had seen in the news that other recovered patients were donating plasma, and around the same time, Spectrum actually called me and they said, you did have a positive test, and we think you would be a good candidate for giving plasma. And I said, well, I was already thinking about doing it, so I'd be happy to. And it was a super easy process. I was in touch with Spectrum, and then they put me in touch with Versity, and we set up a time for me to come in, which was yesterday on Thursday. And I went in, we did all of the pre screening, and I was able to give my plasma. And it's super awesome that I am able to give back like this because it's such a simple thing for me to do. Just giving my plasma and giving about 2-3 hours of my day, then that would be able to help save lives and maybe possibly develop a treatment for COVID-19. It's super humbling, and it's almost, I can't even believe that I'm able to do this.
Hmm. Is it was it a simple process? I mean, is it basically just go in, they take the plasma, and did they tell you where it would go and anything like that, or?
Yeah. So what they're using it for is that it's going to medical research, using my plasma because it has the antibody for COVID-19. And there have been studies in the past with other viruses such as Ebola and SARS, and they've been able to use the antibodies from past patients to help develop a treatment for future patients.
Hmm.
And I'm no scientist, but from what they've explained to me, I think that if they get several plasma donations from other COVID-19 patients that have recovered, it's going to be easier for them to develop a treatment for patients that aren't dealing with it as easily as I was able to.
Hmm. Okay, so probably for people that have more severe symptoms and things like
Yeah.
that.
Yep.
Okay. Um, I guess what was your biggest takeaway from the whole experience? I guess from getting sick to donating the plasma too. Is there one kind of underlying message that you got from it?
Yeah. So I would say don't take your health or your age or your status for granted, because I am a young, able bodied 20-year-old, and I unfortunately did get it. But I just think it's super important to follow all of the precautions that are being put in place for this virus. We have to stop the spread of it because uh, although I was lucky to be able to recover, not everyone can recover, and you never know. Even if you do have it, you never know who you're spreading it to. And I think the most important thing that I'm taking away from this whole experience is that it is a serious illness and a serious pandemic, and that we need to do everything we possibly can, whether it be social distancing or if you're lucky enough to give blood or plasma or volunteer or do whatever you can to help out with the whole situation.
Hmm. Okay. And you had said you had thought about donating plasma beforehand as well.
Yeah. Yeah. So I called actually originally, and they were going to schedule me, but I had to Spectrum got in touch with me to give me the second test to make sure that I was negative.
Mhm.
So I did that, and then I was able to go in and give.
Okay. Um, I think that's all the questions I had for you. Is there anything else you wanted to add or anything I didn't ask about that you wanted to kind of elaborate on?
No, not necessarily.
No?
Just that I hope everyone stays safe and we can get through this if we all keep social distancing and looking out for others.